This half hour, you will see some remarkable stories about DFW doctors that are helping their patients get back to living their lives to the fullest. Like Sherlyn. Sherlyn was living in pain daily due to a hip injury. That is until she met orthopedic surgeon Dr. Charles Toulson.
We're really not sure what happened through the years. It just got to a point where it was just really hard to move around. It was just getting worse and worse, and I was told once that it starts affecting your life, that's when you'll want the surgery.
Sherlyn is a 56-year-old female who had severe osteoarthritis of her right hip. Like most patients, Sherlyn waited many, many years to seek treatment.
His marketing people came in our office, and my coworker started asking different questions because I was still determined I was not going to have a hip replacement.
When we examined Sherlyn, she had decreased range of motion and severe pain in her hip. Her pain was not responsive to conservative measures such as medications or injections. We talked about standard approaches and minimally invasive surgical techniques. For her, we opted to perform an anterior hip replacement, which is a minimally invasive approach to hip replacement.
There was just a confidence of him, and he made me feel secure. That's what I needed. So once I met him, there was no turning back on it.
For Sherlyn, we decided to use the anterior supine hip replacement. This technique allows us to get to the hip joint without damaging any muscle. Patients recover quicker and have less pain than with typical manual surgery.
Well, they do go in from the front, and the scar's very minimal, so your recovery is a lot easier.
Sherlyn's recovery was remarkable. A few days after her surgery, she was actually able to walk without any cane, crutch, or an assistive device.
I have no pain. And even when I was in the hospital, I didn't take pain medication. And they were like, "Are you sure?" I catch myself running across the street or, just things like that. It's just sitting Indian style, just things that I haven't done in forever. And if they called me today and told me I had to get my other hip done, I'd be there. So he's my man.